Hey, good morning, Arizona. On the Health Watch this morning, a Phoenix Addiction Recovery Center is incorporating a type of weight loss medication to treat substance abuse disorders. This is really interesting. Research shows that GLP-1 peptides can help reduce substance cravings. And now the Meadows Behavioral Health Care Center is putting that research to work. So here to talk about it this morning, we have Dr. Aaron Wilson with the treatment center. Thank you so much for coming in. We appreciate your time.
Thanks for having me.
I think these are two really important topics that affect a lot of people, GLP-1s and addiction. So talk to us about the connection and this research.
Yeah, so the GLPs have been around for a while. They originally for diabetes. They evolved into working for weight loss. And what we found is there's a lot of unintended, benefits that they've seen over the years. And most recently, what we're seeing is that might be helping a little bit with, cutting down cravings for other substances. So a lot of the preclinical research has shown that maybe alcohol and some other substances are unintendedly kind of coming down when somebody's on these medications.
Can you talk about the similarity of the part of our brain that wants us to eat food and then may also want us to take part in these dangerous behaviors like substance abuse?
Yeah, so there is a common pathway, the reward center of our brain, the mesolimbic system, and that common pathway is really where that noise is coming from. So a lot of people talk about when they're on GLPs, it cuts down on that food noise. I think what we're also seeing is it cuts down on noise across the board for other substances, perhaps the alcohol, opiates, stimulants, maybe even nicotine. So those studies are all ongoing right now.
I know that everyone's case is different, obviously. So the last thing I want is anyone watching at home to be like, okay, if I struggle, I should get on this. How do you start to navigate that journey and make that informed decision to take care of your health? And maybe if you are someone who's struggling with addiction, who's thinking, I want to try this, what's the best course of action?
Yeah, I think doing a lot of your own research, talking to your provider, talk to a healthcare provider about it. Again, it's early science, it's still in some of the research phases for a lot of these different indications. It's also important to remember it's not a one-size-fits-all, and it's not a standalone cure. So we usually incorporate this into a kind of a comprehensive treatment program for people. By itself probably is not going to move the needle as much as we're hoping, but if you combine that, that's really the research that we're looking at.
It feels like every day we hear about new studies. I think the most recent one I heard was that there's now a correlation between preventing breast cancer with GLP-1 use. When a drug like this explodes in popularity, everyone online, Oprah is talking about it, celebrities. Is there a danger in that, and how do we navigate who to listen to when it comes to making those decisions?
That's a great point. Yeah, and what we're seeing is the number of studies for different indications, inflammation, Parkinson's, osteoarthritis, all kinds of studies, and they pop up every week, right? And so I think the most important thing is to talk to your healthcare provider, get that information straight from the source. It is early science. All these studies are ongoing, and so I think it's just so important that we have that conversation to make sure it's the right fit for you and it's not going to cause more problems than it solves for you.
Yeah, it's just so interesting, though, to think about the fact that maybe this could be a breakthrough in addiction treatment. You work with the Meadows, so you know about that and the facility. For our viewers who maybe aren't familiar, what do people need to know if they're interested in your services?
Yeah, so the Meadows is, we have a residential treatment center here in Wickenburg, Arizona. We have an outpatient program in Scottsdale. We also have programs across the country doing outpatient and virtual care. It's an incredible place. It's the best place I've ever worked as far as treatment goes. We focus on trauma, addiction, process addictions, general mental health concerns, but it's a great place to go. Again, that comprehensive wraparound services, probably the best trauma treatment center that is out there right now.
Yeah, we know mental health and substance abuse often go hand in hand, so it's such an important topic. Dr. Wilson, where can people find the Meadows online, website, all that information?
Yeah, so if you go to themeadows.com, it's kind of a great launching pad to get to, and again, has information on how to reach out for outpatient, virtual, as well as the residential services. We're happy to answer questions. If we're not the place for you, of course, we can help guide people in the right direction.
Not everything is a great fit for everyone.
Exactly.
I think that's the biggest takeaway, is you just have to do your research and do what's right for you.
Yeah.
So thank you so much.
Thank you.
Very interesting, and certainly GLP-1's not going anywhere, so we'll continue the conversation and talk about those. Thank you again for your time. We'll send it to Derek in the newsroom. Good morning.